Hello, hello, hello. I'm just trying to set my lights. Don't know what is happening with my lights. It's dark here. Hello, 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 hello. Refreshing insights. How is my background? Can you hear me? I'm trying to set my lights. Oh, thank you, Mrs. Omotosho. I'm so happy to see you. Yes, on time. Thank you very much. Yes, Mr. Omotosho is in the studio. We are waiting for a few people to join us. Oh, thank you. You can hear me. Oh, good. All right. Our last doctor is also in the studio. Dr. Sherif, I can see you. You joining from your personal account. Okay. That is Dr. Sherif, our last doctor. Thank you for joining me. It's Friday. How have we been? How is the week? Please leave it in the comment section. Hello, new wine platter. Thank you for coming. Thank you for coming. Today we're not going to waste our time. We're just going to discuss this topic: nurse doctor dynamics. So as we can see, we have doctors in the house. Okay. Oh, your background is okay, but you can increase your lightning if you can. I don't know how to. I've been struggling with it. Okay. Hi, J Does. Yes. Let's let's start. I want to welcome everyone to this live stream. Thank you for sharing your Friday evening with me. Thank you for joining me on this live stream. Thank you, thank you. Oh, my big auntie is also online. Olayinka Oluwale, she's on her way to work. Oh, thank you for joining me. So today we're going to discuss the dynamics of nurse and doctors working together. And we're just going to share for our experience, either inpatient, outpatient. And before I start, I want to say the motive of this live stream is to promote good interpersonal relationship because we are team. Without nurses and doctors, the health team is not complete. The health team is incomplete without nurses and doctors. And there has been many instances for years and decades that we doctors and nurses have been working together. But at times there can be that a little friction at times. So we just want to discuss tonight what are these little hiccup that arise and what can be the causes, what are the causes of this, and how can we try to avoid it. That is all our discussion is going to be. We're going to look at it in a more positive view. I want us to look at it in a more positive way. Nurses and doctors, we're going to be working together no matter what to promote our patients' care and safety. So, um, Mrs. Omotosho is in the studio. I think I'm going to invite her to come in first. Ms. Omotosho is a nurse educator. She has practiced as an inpatient in the pediatrics, I think, yes, pediatrics ICU, and she's presently a nurse educator. I know she's got loads of experience working with doctors in this role. So I'm going to invite her into the studio to share with us. I hope I'm right with my introduction.
No. No. So my name is Lola Omotosho. I'm a registered nurse, adult registered nurse, and my background is in theaters, not pediatrics. But I did work in pediatric theaters, and then right now I'm a nurse educator. I work here as a practice education facilitator in one of the NHS trusts here.
Thank you. Thank you for coming. Thank you. So, over to you. Let's.
Okay. The dynamics is different. I think it depends on how we look at it. From my point of view, the relationship I've had with doctors has always been from a surgeon point of view. So you have the consultants, you have the registrars, you have the FY1s, SHOs, and when they come in, I think for me, I give them the respect as for whatever. I don't think I've ever had a significant issue with any doctor before. Of course, you'd have personality clashes. You might have personality clashes. You might like someone might walk into theater and for some reason you don't get on. So, and I think the dynamics. I think it's more of a power play. So who's the boss? Who's not the boss? The nurse wants to go like, I'm the boss of here. When you come into my theater, I'm the boss of here. And you expect the doctor. It depends on the level of the doctor. When it's a consultant, I think they kind of have earned their respect, if you understand what I mean. So they've earned their respect to that level. A more junior doctor might struggle a bit to understand how that dynamic work. I think our roles are very different, and once we understand our roles, everybody can work very peacefully. So I think that's my take.
Yeah. Okay, thank you. I'll come back. I'll bring you back to the studio. Taking off from what Mr. Motor just said, he said our roles are different. I don't want to start mentioning our roles. We know that we have a standard of proficiency in NMC, and we have like standard of 8 standard of proficiency that's talking about us being accountable as a professional, promoting health and preventing illness, assessing and planning needs, providing and evaluating care, leading and managing nursing care, improve safety, quality of care, coordinating care. We see that nurses, we have all these roles. And I know that we have doctors in the house as well, whereby I've read through some of your domains, but I will allow you people to tell me. But our roles interlock is like we have similar roles, and there is no doubt our main aim is for patient safety. We are there for the patient. So that's if there is any issue with the nurse and the doctor, at times the patient will be the one, at times the patient pay the price. And we know that we have some causes of this. So before Mrs. Oluwale go off, I don't know if she can come into the studio. If you can show your face, you can speak, we can hear you. Click on the link if you can come in the studio and tell us from your experience, what are also the causes? What can cause it? We've heard from Mrs. Omotosho, yes. Experienced doctor consultants, their relationship is different, and at times some doctors. Thank you, Mrs. Omotosho. Mrs. Oluwale, are you able to come into the studio? Hello? Okay. New Wine, do you want to come in briefly and in a doctor's perspective, you want to come into the studio and share? Click on the link in the chat to come in and share your thoughts. New Wine Platter. Hello. Okay. You can also leave your comments in the comment section, even if you're not a nurse or you're a doctor. I know one way or the other you have interact with nurses, you have interact with doctors. So what do you think are the dynamics? What is your experience? You can leave it in the comment section. It's an interactive evening. New Wine is in the theater, is in the, I say in the theater, sorry, is in the studio. You're not in the theater today. Oh. You even left the theater for a long time. She's now a GP, full-time GP. I will allow New Wine Plaza to introduce herself.
Okay, it's nice to be. It's nice to be. Sorry, can you guys see me? I feel like I'm drifting away. Okay.
Yeah.
Okay. So yeah. Okay. Good evening, everybody. I hope you guys had a very lovely week. Thank you so much. We've had, okay, let me just introduce myself. My name is Dr. Helen. I am a general practitioner in the UK, and I'm very happy that we're talking about this grand topic. And thank you very much for our lovely theatre nurse that's just spoken. So just to buttress on what she said concerning the power tussle between doctors and nurses, I also think that another cause of conflict is like personality differences and a bit of egoism as well. And also because I feel some doctors see nurses as subordinates in the team. Rather, they should be seen as partners, not subordinates. We're to work together as part of a team. Even though we know that the doctor heads the team, right? But we still need to work together to be able to deliver good healthcare. Another thing that I think might be a major reason why the conflict is also the workload. Okay, so the burden, it can be really overwhelming. So the doctor feels really stressed. The nurses too, they have a lot of workload on their hands. And if things are not progressing as they would love to, this can cause a lot of conflict. So say, for instance, the nurse is beckoning on the doctor to come and sign maybe a drug chart or and she's been calling, beeping, and no response. You know, that can cause her to have clashes with the doctor. Also, the fact that we're not able to manage our stress levels adequately. So you might just want to pour, you know, like an outlet to just pour that stress out. So it might be to the other member of the team. So I think that as doctors and nurses, we need to learn how to manage our stress levels. If we feel like, you know what, it's becoming really overwhelming, we can take a break or just talk to the other person and say, you know, can you just, I'm just so tired. Can I just have a break? Or can you just do this? Can you help me check the blood pressure? Even though I'm the one that's supposed to do it, but can you just help me? I'm just feeling a little bit overwhelmed at the moment. So those are the things that I feel like can be causes of conflict. Also, lack of communication. When there's lack of communication, say for instance, the doctor says she's going to be on the ward at so time. Oh no, she's saying she's going to come to the ward, right? But she's not giving a time frame to say, okay, I'm going to come in the next hour, because most times when doctors say they're coming, it might be the next morning.
Yes.
Or the next week.
You know, I'm going to be there in the next 2 hours, trust me. And then the nurse is a little bit relieved that, yes, at so time I should expect it to come. So lack of communication is another reason why we have conflicts.
Thank you. You'll be back, New Wine. Just to buttress what New Wine said, lack of communication. You know, when I call the doctor, probably I want you to come and review the patient. And it's not only me, I'm just being sincere. When I call, the next thing I'll look at the time. Just to see. Because as you say, at times we call expecting, and we're expecting the doctor for minutes, for hours, the doctor is not coming. You just get restless that what do I want to do? And the reason is not because the doctor is have the reason for not coming, but for me, the patient is at the doorstep, is knocking at the nurse's station, is asking, when is the doctor coming? What are you going to do about this? Because we are there with the patient, we are physically present. So the patient put more pressure at times on us, and you don't blame them because they need help. They are in our care for a purpose. So when they need something and we say the doctor is coming, they will keep asking, where is the doctor? Where is the doctor? So what New Wine Plaza has just said is really good. When you give a time that you're coming, if it's going to be delayed, I have many doctors that will just call. You know
Yes.
what? I'm in the acute now. For example, at the moment I'm working in mental health, acute inpatient. At times, my doctor can tell me that I'm in PQ, and PQ is like greater than acute, because that PQ is like the fire zone. I'm in PQ. I need to do a seclusion review, so I can't ask him to leave the seclusion review and come to the ward. So, but if I don't know where you are, if you say you're coming, and I keep waiting, I'll be like, what is wrong with this doctor? What is happening? So thank you for bringing that in. Thank you. I want to bring Mrs. Oluwale in. She's been in nursing for a long time. I want her to share her experience before she logged on. She's going to resume duties soon. So I want her to come in and share her experience before she goes. Mrs. Oluwale, are you there? I can see you online. While we are waiting for Mrs. Oluwale, I just want us to start suggesting, even if you're not a nurse, if you are there in the comment section, what are the ways that we can promote it? We are identifying what can cause a kind of friction. Also, we need to come out with ways whereby we can promote it or we can avoid this. Please, you can leave it in. You can leave your comments in the comment section below. And okay, thank you. I'm going to read this. Ms. Oluwale said, another issue could be the problem of gender differences. There is a way men behave generally from women. The male-female psyche also has a major role it plays in doctor-nurse dynamic. I agree with Ms. Oluwale. You know, at times when you have a female doctor on duty, probably because you are female, it's like you kind of relax and I crack jokes and just get along. But at times when the male come in, it's just like, just want to get things done official. Let's just do this. And so at times that might be an issue. Thank you for that. Thank you, Ms. Oluwale. Our last doctor, are you ready to come into the studio? Our last doctor. Okay. Our last doctor, we're waiting for you to come into the studio. While we're waiting for our last doctor, I will start by explaining some ways whereby we can promote this relationship, because the motive of this live stream. Oh, our last doctor is in the studio. Yes, our last doctor is Dr. Sherif. She's an A&E consultant, and I'm going to allow him to introduce himself more. His YouTube channel is Alert Doctor. He has many medical videos on his YouTube channel. He's an A&E consultant. Welcome to the studio, Alert Doctor.
Welcome. Thank you very much.
You're welcome.
This is my first time I'm doing this.
Don't worry, we are all new. Yes.
Hello, Mrs. Omotosho. Hello. Yeah. And hello, Unique Space.
Thank
Nice
you.
Yeah. So, like she said, I'm from Alert Doctors, but my name is Sherif Adeomi. I'm actually an ED consultant with NHS. But I've been a consultant for just less than a year, to be precise. And I've tried to run Alert Doctors in the background, which is more like a way of providing health information to people generally, not medical people, non-medical people, telling them health tips on how to, improve their health. That's it, and the lifestyle.
So you can check out his channel. He has many videos there, and if you have not subscribed, subscribe to his channel, and also to New Wine Plaza. We're just there sharing our information. Yeah. Over to you, doctor. So
Okay.
Dynamics of nurse doctor working with your experience.
So
inpatient
you've had good speakers, and they've really touched a lot of things. Okay, they've really touched a lot of things. the way we do things in A&E is a bit different. Okay, it's a bit different, but because we see ourselves as equal, we respect one another, and that's how it should be. So why do we have doctors and nurses always having, well, not all the time, but some of them having issues? And one or two people have actually touched on this, and we talked about personality of either the doctor or the nurse, because it could be either way. Usually it tends to come from the doctor. It could be a female doctor or a male doctor, and to the opposite gender. That tends to happen a lot. Another thing that I tend to look at is more inexperience of the doctor. So a doctor who just started working as a doctor could say, "Oh, I'm the doctor, yeah. So just listen to me." But actually, you can't just do that, because you have got a nurse or a sister who probably has got length of years of knowing this is how things are done. I've seen your bosses, as your consultant, grow from a foundation or house officer all the way to become consultant, and then you are coming in saying, no, I'm the doctor, this is how to do things. So that, inexperience is one big factor. And really, as they grow and learn in the job, and with supervision, then they tend to now realize how important it's actually that we are all in together, because it's a teamwork approach.
Yeah.
My own experience, for instance, like the ITU nurses are the ones I fear most, because I believe they know this thing very, very well, in and out. So I don't even joke with them. The ITU nurses, they tell, this is how we do things. Yes, that is how we do things, because they know the things. So I've learned. I mean, I've practiced for about more than 10 years. So I've seen the experience of both sides, both in Nigeria, where I come from, and where I'm actually practicing now. And what is keeping me going is the fact that I see my colleagues, the nurses especially, as my team members. We work together in order to actually help the patient, because all this, what we're doing, it's all for the patient, isn't
Yeah.
it? So I've actually appreciated them more in that role, because when I go to any place new, I ask them, how are things done, and they will guide me. They always do that. They've never really stopped. So one of the speaker also touched on communication, and yes, it is very, very important, very, very important, because doctors are known to write poorly, bad writing. Sometimes they'll just write things and you say, what's that? And then, a nurse would come and say, oh, what have you written? Is that paracetamol? Yeah, it's paracetamol or something. But, if you was somebody who was inexperienced, could actually think it was something else, maybe it's not paracetamol, maybe it's, let me see what we can use, maybe, I don't know, just any of these drugs, okay? Maybe phenytoin, and then you go and give that, and then things go wrong. So at the end of the day, who do you blame? Whether it was the doctor or the nurse. But actually, even at the beginning, the doctor has not communicated this effectively. You've written it down. You've not actually spoken with the person you want to give the drug to. Say like, oh, could you give this drug? Oh, well, you've not written well. You've written phenytoin. Oh no, it's paracetamol. That I've written. So these are things that I think that from the doctor side they can always improve. Now, from the other side, to nurses too, we do have one or two times when we have clashes. And I think one of the speakers also mentioned, we actually was from the chat room, they mentioned gender, and it could be, say, like the male nurse versus the female doctor. And there's this kind of ego coming in that, or a younger doctor trying to actually pass the message across, and this nurse is not too happy to actually take the information being passed across to him. And so if we all work together, because we're all working for the same goal, which is the patient, our patient, we'll work fine. I mean, in my own place, we work there. We even go out. We go out a lot. I mean, pre-COVID, because just before COVID, we would go out, have Christmas party together, or just go out for a drink and have fun, get to know ourselves. So that's one thing we tend to do a lot. But although we're now in our shells because of the COVID era, but I mean, I'm hoping this after, once the post-COVID era comes, we'll all come out again and continue what we normally do. I hope that is enough to start the.
Yes, that's enough to start it. Thank you for your experience, for sharing your experience with us. I know that A&E, you are enjoying it, but at times there can be some other A&E that probably there is an issue with their relationship with nurse and doctor. For example, at the moment in my team where I am, we don't really have any issue with doctors, because the doctor, when doctor come into the ward, we have a way whereby we do our MDT, and that is where I'm going to. When you sit down in an MDT to discuss with patient focus, have a time to sit down. The nurse is there, the doctor is there. We do the handover. Okay, who are we seeing today? What are the needs? Like, as a nurse, you have identified the need. You know the doctor that you want, the patient that you want your doctor to review, and you have identified the needs of the patient beforehand, and we have discussed this. When we sit down, it's very easy to have a good MDT and to progress from there. But when you get to the ward and it's like probably the doctor doesn't even turn up, you don't know when the doctor is coming, or the doctor turn up, there is no schedule. Who do you want to see? Just pick a patient. Just, at times when there is no proper organization or set MDT, at times both parties can start getting angry. I also want to bring in attending to our emotional need. Nurses and doctors, we can look after ourselves. There can be instances whereby somebody might be under pressure. Probably the doctor has been on call for a very long hour, and his late hour has been going from one ward to another. Probably he's not having enough drink, he's tired, he's stressed out, and he come to your ward. As a nurse, probably you're not able to identify it. You don't know when the doctor has been on duty. You just want to write that prescription or see that patient and just get out of the ward. But when you come in, when you ask about it, oh, how are you? Have you been on call for a long time? When did you start your call? Is it 5 minutes ago, 1 hour ago? And so, oh no, I've been on call since 5 p.m. And you look at the time, it's 10 p.m. Hope you've had something to drink. Have you had something to eat? Those simple things to me, I say is very important. I was seeing the doctor whereby the doctor coming onto the ward and he looked at me that I'm very, very busy. And he said, oh, I think you are very busy. You want to start asking for some things, but when he look at his diary, you know that he can reschedule some meeting. He has to reschedule the meeting that the ward have high clinical activity at this time, so we can reschedule this. So at times, trying to be present and attend to our emotional needs as well, it can also help us to build a good relationship.
Yeah, so I agree with you.
Thank you.
Yes, the reason why I agree, because I'm sorry, because emotion, you need to be mentally well as well to attend to a patient. You need to really be emotionally right to really attend to somebody. So the way because I work in a stressful environment and it's always busy, you're always moving, you're cool now, and the next thing you do something very, very critical to a patient to make the patient better. And then the way we do it around, sometimes we bring in sweets, just to keep us going. Sometimes we just have tea, and we do it amongst ourselves. The doctor could actually make tea, but most of the time it's usually the other way around. They don't say, "Oh, I'm going to make tea for you. You've done a good job for this patient today," and that keeps everyone going, and because if you are having grudges with your colleague, that is your nurse or a doctor there, and you take that to see a patient, your mind usually will be clouded, because you'll be thinking about what you is going on there, and you're not having a clear mind to actually attend to this patient, and the patient could actually tell you something very, very important that will actually make you diagnose or manage this person properly. But because you're not really listening, because you are fighting Miss B for being rude to you, and and the patient might say, "Oh, I'm allergic to, say, penicillin," and you might not remember that. You say, "Oh, he's got no allergies," and then you give antibiotic, and then that becomes a big problem. So emotions, definitely, you need to have the right mind, and the way to do that is just carry everyone along. Be humble, to everyone, because humility is a virtue. It should take you far.
Yeah, that is, in fact, that's another point I was trying to say. Be humble, because either being a nurse or being a doctor or anything, is like, just humble yourself and just feel that this position I am is not a reason for me to maybe raise my shoulder or look down on the other person. Humility is a big virtue that can really help. If you are the ward manager or you are the nurse, it's true you have all the patients in charge beside you, but you cannot do it alone. Without the doctor's prescription or anything, you can't do anything. And the doctor, if you just get there, probably I'm the nurse or I'm the doctor, I'm the consultant, and you just want to use this power or ego, looking down on your subordinates, it won't go well. So just be humble, identify your job role, stick to your job role, and also look after your colleague. It's really helpful. Thank you. Thank you very much. Dr. New Wine Platter, do you want to come into the studio? New Wine Platter, do you want to come into the studio? I want you to share alongside workload. I know you mentioned it the other time, because workload is a big is one of the big problem we nurses encounter. And I know you, doctor, as well. So with your experience, you want to come into the studio?
Okay. So thank you so much, Allied Doctors, for what you said. I just wanted to buttress on the fact that, if we have very good relationships, we'll be able to do a lot more together. I want to first of all say, at the point in my life when I started to respect nurses was when I was a medical student in my teaching hospital back then in Luz. So we were on a ward round and we were going from patient to patient. So our last patient was very poorly, and then the consultant had kind of like changed the medication, done some alterations and things like that. So we left that ward, but for one or two reasons, I needed to go back to that ward to pick up something. So I saw the nurse by the bedside of this patient, pleading with the patient to take the medication. So this patient was adamant that I wasn't going to take the medication. So she was trying to say, it's for your good, please take it so you can get better. But the guy, the man was just like, no, he's not taking it. And she spent a lot of time trying to persuade that patient. And from there on, I just saw that, you know what, it's easy for doctors to come around, do their ward rounds and all of that, write medications. If this patient does not take the medication, it's a futile exercise, like it's unfruitful. So we need to respect whoever is ensuring that these medications are administered, that the care is delivered, that everything is ensured and delivered properly as we want it. So, and that's why nurses are so important. They're caring. And if we learn to respect that, they do a lot for us. I think it would also make sure that it will also help our relationship to go smoothly. Also, humility is very key, which is one of the things that Allied Doctor picked on. And I cannot overemphasize this. To be honest, first of all, during my training, nurses have taught me things. Like, it's part of our training that nurses teach us things. So you learn from maybe the asthmatic nurse, the diabetic nurse. They have a lot to offer. And even till date, there's sometimes that the nurses will come and say, oh, doctor, we have a new inhaler. Have you not heard about this inhaler? The delivery is better. It's not breath attenuated. Maybe you should start prescribing this. And I've learned a lot from the nurses, and I'm still learning a lot from the nurses. There are times when they'll come and say, oh, You know, they'll make suggestions that are very, very valid. So if you're that egoistic person and you feel like, no, 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 my shoulders are high up, you know, nobody can talk to me, I'm the head of the team, you know, do you know how long I had my training for? Blah, 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 blah. You can easily go down. There was a time when I think I was seeing a patient and I forgot something very vital. I forgot to write the antibiotics, even though I'd said it in the plan that I was going to start this patient on antibiotics, but I didn't write it down. And it took a nurse to bring that to my notice to say, oh, doctor, what's it called? You didn't prescribe anything. But I can imagine if I didn't have a good relationship with her, she would just be waiting for my doom to happen.
Thank you. Thank you for sharing. Thank you so much. So I've got my colleague with me here in the studio, classic Jessica.
Always late as usual.
So Jessica is my colleague at work. She has also worked in A&E, though she's a mental health nurse, but she works in A&E to support the general nursing in the mental health state. And at the moment she's on transition, but I'm going to keep that here. She's got some experience that she's here to share with us. Jessica, over to you. What do you want to say about nurse-doctor dynamics in a nurse?
I think all the points that I've only come in probably, I was watching it on YouTube trying to figure out how to get on StreamYard. So I've been watching some of it and all the points are amazing. And exactly what you said is right, is communication between doctors and nurses is so important, but also relationships. And I think the point about the ego is because sometimes we all want to be proud, we all want to do amazing at our job, and sometimes just taking that step back and seeing other people's point of view and saying, well, this is what I think, what do you think? Obviously we know better than everyone. We're struggling with doctors where we work at the moment. Doctors, like, we're just constantly on the phone to them. Obviously in A&E you've got them there 24/7, so we don't have that. We have to get that. So I think the more respectful you are to your team, the more you get out of them. Like, the more you work together and you've got a good working relationship, the more you do, everything just flows. It's like kind of yin and yang. The more, it just makes things so much easier. If there's conflict, it just makes the workplace difficult, which then affects patient care, and then it affects like staffing, team morale. So I think just communication and working together is the most important thing, because it's a hard job for all of us, whether we're a nurse, a doctor, a domestic. It's a hard job, and sticking together is, especially in times like this, is what we all need to do.
Thank you, Jessica, for coming. Yes, New Wine has also mentioned that, and she shared a personal experience, and I really, really thank you for sharing your experience. Working together, we cannot overemphasize the importance of communication. Communication is the bedrock, is the key. The way we communicate is important, and how we communicate is very important. Thank you for coming. And I want to go back to Mrs. Omotosho. I want you to come back to the studio if you don't mind. So, for example, if you notice that there is a kind of friction, or things are not going how it should go, how do we address this?
Okay, hi.
Hello.
Hi, yeah. I think maturity. We have to be mature, and we have to be professional. If you're not getting along with a particular doctor, or a doctor is not getting along with a particular nurse, and you know you have to work together, the most important thing is, I don't have to like you, which is the fact. You don't have to like me, but we have to work together. We have to be professional.
Job done.
For patient safety and for the patient care. So if you can have that conversation, some people feel, let's have this conversation. I sit you down, take you into a corner, a quiet place, just me and you. Do you mind? Let's have a word. And once you have that opportunity, and then ask is there anything I've done wrong to upset you, or I notice there's this friction between us? Can we put this aside because it's affecting? And there's no way we would have conflict at work that it wouldn't affect the whole team dynamics. There will be eye rolling, there will be silences, there will be sighs, and all sort of things that could affect. Even if I have something that can help the situation, I'm keeping quiet because I don't like the doctor, or the doctor is keeping quiet because he doesn't like the nurse. And if we can have that conversation as matured adults and professionals to say, can we put this aside? I'm sorry, you're sorry, we put it aside. And sometimes you might not have that conversation and make your choice to be professional. You know what? I'm going to get over myself to say, okay, fine, you don't like me. It's okay, I can deal with that. Or, yeah, I don't like you. But when we come into our works, when in the theater, for instance, you do your job, I do mine. And I'm not going to sabotage what you're doing. Don't try and sabotage mine. And I think it's about having that matured stance to think, okay, this is what I've got to do as a professional. This is just a job. You know, we're not in each other's lives as it is. I'm not going to walk out of the door and, you know, have a relationship with you. Most likely not. The relationship I have with you is strictly work. So it's me coming in the morning to come and do a good day. I mean, to have a good day and then working together. I often say this, that nobody coming from their homes, waking up at 5, 6 a.m. to come to work, plan that, oh, Lola, I'm going to make your life a living hell today. Nobody does that. But then we have all the ego, the personality clashes, the all sorts of things that cause conflict that happens. And sometimes when it's not addressed early enough, it builds up. And if you know nurses, well, we're nurses, we talk. And, oh, have you seen Dr. So? Oh, she's crap. Have you seen Dr. So? Oh, he's a no good. Have you seen? And that news goes on, and everybody don't give that person a chance. And even the doctor on that, from that point of view, thinks, oh, this is an all-star ward. Nobody likes me. It's difficult. So he or she comes in, blocked, emotionally blocked, just come in, do my job, write my prescription, and get out. And get out of the ward. And I think if we can all be mature adults, have a professional stance, and communicate properly. I don't like what you just did. I'm not trying to be rude, and we respect each other. I respect you, you respect me, and it is earned. You like some doctors better than others, maybe because of their personality. Some doctors make it easy. They come in. I think most nurses, I don't know if I speak for every nurse, but most nurses like doctors who know their stuff.
Yeah.
And even if, because I don't have to piggyback you. You know your stuff, you do your stuff, and I do mine. And we have a good cohesion going on. But when you come across as if, like every doctor has gone through a proper training, some are better than others, not because they're better skilled, but maybe their delivery is different. Some you will find very easy to work with, some very difficult and challenging to work with. But I think we get over ourselves, we be professionals that we are, and just carry on and be adults. Have a conversation if necessary, or just let it go.
Oh, thank you very much, Mr. Motosho. Thank you. In fact, what she said, maturity, then that maturity is very important. I want to cite an example from that. You know, when I was working back home in Africa, then there is this A&E. We have like forms for blood observation, blood test, and everything. And there's a trolley whereby we put all these forms, and the doctors are familiar with that. With it, they know that they'll go there and get this form. And there's this new doctor that just came in and was asking the nurses, go and give me go and bring the form for me, go and bring the investigation. So we're looking at each other, that what is happening. So on reflection, I was like, I think the best way to approach it then will have probably to give him proper orientation that, okay, when you come into this world, when you go to this trolley, all your blood forms are there. But then I will say we're very upset. I was upset that do you think that nurses will run errands to go and bring your blood form? You know where you put your blood form. So if by maturity, if we say, okay, you are new here, we can't be bringing you form, blood form, or ECG form. You have to go to this place and get your form. That is how it is done. I think probably our relationship would have been better then, but
Yeah.
then there was kind of, and also recently, I remember there was a time somebody just gets into the unit and he was asking the nurse that he doesn't know how to operate the ECG machine that is there, which is more sophisticated. You want the manual one, and you want the nurse to go and get it in another unit. So, like in that situation, you can say that, why do you want me to do that? If you don't know how to operate this one, you have to find a way of going find a way of getting the other one. So no nurse is, no doctor is better skill, but it's the delivery. I'm going back to Dr. Mr. Motoshaw's quotes. Not that they are better skills, the delivery. So probably the way we say it or the way we do it might affect our relationship. Thank you, Mr. Motoshaw.
You're
And
welcome.
I also want other people on the platform. I can see refreshing inside our BCC. Don't say you are not a nurse or you are not a doctor. I know that one way or the other you have interacted with a nurse or a doctor. Please leave your comments and let's see what you think about this nurse-doctor dynamic. And also, I want to go back to communication that New Wine Plaza said with her experience when she was an house officer with that matron. You know, if she doesn't have that experience, I don't know what she'll be saying today. So it's good as a nurse as well to be able to present herself as being homely, as being friendly. It's like you are in the house. When you have a guest in your house, you're not going to look at the guest and you're going to welcome the guest. You welcome, how can I help you? So at times I see it that way, that I'm on the ward, and when the doctor come in, I'll just try to say, okay, yeah, this is my name. Can I know your name? This is what you want me to do. And from there, we start getting along. Some people put it in quote that probably because my husband is a doctor. And I said, no, I don't know if my husband is not a doctor. I may not relate differently. You just feel that when you are in a place, make yourself as friendly. So either wants a friend, you first make him or herself to be friendly. Put on that positive attitude towards the person coming in. Even if he's not a doctor, let me say he's other professional. When they come along with you, make yourself friendly, homely, welcome, social, and I know that this health sector will be a better place. I want to go back to Jessica. What is the difference in working with a doctor that is present on the ward? I know that you have mentioned it before, but because you have been in both places, you've been in A&E and you have been in an inpatient, and you have nurses there in both. So what is the major difference that you can identify?
There's positive and cons to both. The only thing is, sometimes, because in A&E, like as a nurse, you're not kind of the one that patients want to see. They're waiting to see the doctor, like.
Yeah.
Yes.
You're just kind of like, they see you as like just this interim and they want to see the doctor. And sometimes, obviously, you get things, obviously, because for us in mental health, our emergency score is different to what would be in A&E. So say if certain emergencies for us in inpatient would be a lot different because of the resources that we've got. So in A&E, you might go up to them with a problem, but the doctor's got so many different problems that yours is really to the bottom. So you're taking all like the negative responses from these patients because they don't want to see you, let's be honest. They're waiting for the doctor. They just see you as a hindrance, get you out of the way. And some doctors know that. Some doctors do know that. And I think what you said is spot on. To just be mature. We just kind of let it go over his head. And I think it's a lot more stressful for doctors in an A&E setting. So I think their delivery sometimes can be really sharp and abrupt, which I think sometimes, because you're so stressed, you can kind of pattern that and give them the same response. And it's about you then being the one, right, take a step back, we're all in a difficult job, right, let's go in with a different delivery. But I think it is so difficult because in such as like an inpatient setting where we are, nurses are what patients want to see, because on the shop floor they see the nursing assistants, and to see you is what they want to get their treatment. So it is very different in terms of hierarchy in an A&E, because you kind of at the bottom, and some doctors make you feel as though you're at the bottom, but then they're the ones that you, like you said, you don't want to go above and beyond for, because they make you feel like absolute rubbish.
Yeah.
Whereas the ones that come in with such a positive attitude, like I can have times when I'm stressed, my delivery's not the best, I can be a bit sassy, and I will openly say, gosh, I'm so sorry, because it's about recognising how you're delivering yourself, let alone how you're accepting other people's delivery. So it is very, very different, just because you are kind of at the bottom in people's view in an A&E. And the doctors are one that we're constantly going to in an A&E setting, saying this patient needs to be seen quickly, this patient has got this patient has got that. Whereas that's what the nursing assistants obviously do to us. But I think nurses have a higher tolerance of it, and I'm not stereotypical, but I think it's because in an A&E setting, the doctors are aware they've got every single patient to see. Whereas such as inpatient, where me and Phoebe are, they see the emergencies, they like the high critical, whereas for doctors, they've got to see everybody in an A&E. So I think it's kind of just balancing all your stress of everybody. And like I said, just having a good environment. I always think, come on to a positive day. We do not because we always say, come through the door, try and not think about all your work stresses. But it weighs heavily on your shoulders, no matter how much you try not to. And I always try to, if other people are kind of not very good, just knowing they could have stress at home, rather than taking that, like you said, just being mature, put it out your head, right, we've got a job to do. And we came into a job to look after people. Like you said, you don't have to get on with people. I am beyond lucky, like, such as Phoebe. I think she's absolutely fantastic. Like, I get on with her. But there's never going to be 100 Phoebes. It's just not going to happen. So, at the end of the day, we've got a job to do. Do that job, go home, the next day, do it all over again, and just try and be just nice to each other. We always say that, be kind, because we don't know what people are going through. That one nasty thing that you do to, like, us say to somebody, that could just be the tip off for them. So, yeah, it is different in an A&E and patient setting in terms of where we are, because, like I said, in an A&E, we're just way at the bottom. They don't want to see us. They're not bothered. Get us to the doctors.
Thank you, Jess. Thank you. I know that some of you don't know me as a Phoebe. That's my Christian name. So, and that's what I'm doing at work. So when Jessica was saying Phoebe, I will be looking, who is Phoebe? So I'm saying closely. Yeah. Oh, yes, Mom. That's my work daughter. Thank you. Thank you, Jessica. I'm just going to read this from the screen. Refreshing Insight said, stress as a result of too much workload on both parties can cause friction if not managed properly. As previously said, communication and looking after each other's emotional needs could help. Thank you, Refreshing Insight. Absolutely. Yes, looking after our emotional needs and physical needs can really help. Thank you. I spot Dr. Osari Gwemoyo in the house. Do you want to share with us your experience? Yes, Nurse Doctor Dynamics. If you want to come into the studio, I'll drop the link again. You can come in to share your experience. Thank you, everyone. We're going to be rounding up soon because I know it's Friday night. We want to get back to our movie, to our popcorn, to our family time. you just want to create this awareness. We can work together in a very good atmosphere, promoting our patient care. I've dropped the link if Dr. Moyo wants to come into the studio to share our experience. And while we are waiting for Dr. Moyo, I want to say something about, especially for nurses. Is, you know, nurses, as Jessica has said, we hear a lot from the patients, and many times I've said it before, we are there for the patient and we hear all lots, and the doctors just come, they want to see the patient and go. But without us communicating what we've had, probably doing one-to-one time. In mental health, there's what we call one-to-one time, whereby we sit with the patient, we have to assess it, assess their physical need, do a kind of holistic assessment. So this holistic assessment, many times, normally come onto our head. I don't know how to put that. I don't know how to put that grammar. After the holistic assessment, we have things that we really want to be done, that I want to take to the doctor. Okay, this is my patient's need. This is what I want you to do. Meanwhile, the doctor has come in. Doctors in the house, you can correct me if I'm wrong. The doctor has come in. It's like they have this case load. They have what they want to do for that day for this patient. Now you bringing out other things that you dictate, maybe when you are having this time with the patient. The doctor might think that, oh, that's not what is important now. Let's discuss this particular issue. But we want everything. We want everything to be discussed. Am I right? So, doctor, is it Dr. Alat Doctor or New Wine Platter? Do you want to answer that question? How do we deal with that when nurses have all the time with the patients and we have all these holistic assessments and we present it at your table? New Wine Platter, Alat Doctor, do you want to respond to that? Or if they're not, or if anybody can respond to that, because at times these are some challenges that I've found at times, that I want the medication to be reviewed. I'm thinking of their housing. I'm thinking of OT. It's like I'm thinking of everything. I just want the patient to be comfortable.
Can I say something about that?
Yes, thank you.
I think when we have such pressing needs that we want done immediately, what the doctor is interested in is, what do I need to do first? What is the priority? What's the sickest? Who is your sickest patient? So, and if we use the communication tools we have, like the SBAD, if you use SBAD to go to your doctor and tell the doctor, this is what I need, and I need you to see this patient in the next half hour, need you to see this patient in the next hour, or whatever it is that you require. But it has to be, don't come and tell me the whole story. I don't need the whole story. What do you need me to do for you now? I've got 1,000 other things to do. So it's about you choosing what is priority for me right now. And I think when that communication is clear, you get what you want, the doctor gets what they want, everybody's happy, patient is safe.
Thank you. Thank you. That is that. If I deliberately bring that question at times, because at times we just want everything to be done at the same time, forgetting our SBAR. So thank you. I think New Wine is in the house. Thank you, Mr. Motosho. New Wine, can you come into the studio? Yeah.
Thank you very much, Mrs. Omotosho. You said it well.
Yes.
And that's the place of triage and attending to the emergencies first. So there's some very pending issues that cannot wait. But when it comes to the other issues that the nurses are concerned about, maybe the holistic care, okay, we're discharging this patient, is it going to have care package, this and this and that, we can always arrange to have like a little MDT where we can attend to those other things. But for maybe at that point in time, let's just do the very, very key things that cannot wait, and then the things that can wait we can always schedule for later when we have a bit more time.
Thank you exactly. Thank you for that. So when we have other pressing need, we have to arrange for MDT, and I think that is where I'm going. Jessica, when we were trying to liaise with other medical team, planning ahead for MDT. So, hello, yeah. So when we're trying to liaise with other team, this patient need housing, this patient, because in mental health, we even do something like even requiring for finance benefit. We do all those stuff. Everything is on the arts of the nurses. We wear a lot of hats. So
I think also it's hard for us because we haven't got doctors on tap. Like, I think some patients think doctors are there 24/7, but they're not. Like, they have sometimes, as much as we've got other things to do, they're doing the exact same things. And I think it's understanding each other's job role. So it's easy sometimes. I've been guilty of this. You've been busy, you've got patients screaming at you, I need to see a doctor. But it's something that's not an emergency, so you don't bother the doctors. But meanwhile, you're a bit bitter that you're dealing with this patient and the doctors in the office. But they've got their own jobs to do, whether it's GP summaries, other things to get patients moving just as much. And I think it's, as long as you understand each other's job role, it just makes life so much easier.
That's right. Understanding each other's job role. That's right. Thank you, Jessica. A lot of doctors say it's a bit different in A and E, but holistic approach is the best way. Absolutely. Holistic approach is the best way. He said sometimes we want to discharge the patient in ED, but the nurse will make the doctors realize that this patient needs carer started again, which may sometimes overlook. That's right. Thank you all. Before I draw this live stream to a close, I just want us to stress that these 3 points about communicating rightly, prioritizing, and looking after our emotional needs, looking after ourselves. We can work together. Communication is very important in good working relationship, not only with doctors and nurses, even with every other health professional, liaising with other practitioners. Good communication can foster can promote a good delivery of good health care. So as doctors and nurses, I just want to put this video out there. If you're watching live or you're going to watch the replay, what we're trying to promote is a good interpersonal relationship. If you are there, you are struggling with your own health, we can be matured enough and talk about it. If you have a challenge relating with somebody, as Mr. Motosho said earlier, you can approach that person with maturity and explain, and everything will be sorted out. We cannot stop it. I don't think any decade to come that nurse and doctor will stop working together. No, as much as we all have our autonomy, and there are many areas whereby people are working independently, but there's always area whereby doctors and nurses will always come together under one umbrella as a team to deliver safe health care to our patients. These are calling. Thank you, everyone. If anybody have any question, we're going to close this live stream. As I said, I don't want it to be more than 1 hour, and it's already 1 hour and 3 minutes. I want to thank everybody. Okay, go ahead.
Sorry, just last word from me. It's just I think with the nurses and doctors, it's been age-long rivalry.
Yeah,
between the two professions, and I think it's important that
yes,
it has to be improved. I'm not sure we'll stop, but it has to be. We have to do better, and I think most importantly is for us to learn to be kind to one another. Let's respect each other and be kind. You cannot. Everyone coming in to work has something they're dealing with. The fact that they're not wearing it on their shoulders or on their faces does not mean they have what you're going through is worse than theirs. It's just because they have better ways of dealing with it. So it's important that we be kind to one another and respect each other. Thank you for having me.
Thank you so much. Thank you for coming. I know you said you are very busy, that you try your really best, and you tried. Thank you. Thank you for coming. Thank you. Yes. Any last word from New White Platter, from Jessica. You want to drop our last notes? We are here to promote that positive relationship with doctors and nurses. It can get better. Yes.
Thank you, Phoebes.
Thanks, Jess. Thank you. And what the change? My challenge is that whatever change we want, be the change you want to see, and be the change you want to see. New White Platter is in the studio. You want to give us the yes?
I want to first of all thank Unique Space for organizing this talk, and I feel that it's really relevant. I don't think I've seen a lot of this kind of talk before, so I really want to thank you firstly for doing something like this.
Thank
I want
you.
to say thank you. I want to say that let's be kind to one another, because I feel like, I think someone has mentioned that's the bedrock, because when you give kindness, you get kindness. You understand what I mean? So many times I go to meet the nurses and I just say, please, can you just do this extra thing? And I know that they're really busy, but they'll just go the extra mile just to do that extra thing, maybe just slot in a patient. Well, I'm talking about a GP setting. Maybe they'll just, do blood for that patient. And I really appreciate them. So when they come to me and they ask for a favor, I'm like, oh, don't worry, I've got this covered. And I just find out that as much as I show them kindness, I respect them, I greet them properly, I ask after their well-being. So if I meet them in the kitchen, I ask, oh, how's family, how's everything, even though I don't get to talk too much with them, but in a professional way, I'm asking after their well-being. They see that I'm genuinely, kind towards them, and in that way I get the same back. So let's be kind to one another, because we all matter.
Thank you. We all matter. Let's be kind to one another. We all matter. That's a good one. Thank you, everyone, for joining me. This is Concepts. I can see you. Thank you. A refreshing insight. Thank you. You guys are not doctors, but you join into this section. Thank you very much. And be that person. Be kind. And I will see you next in my live stream. Thank you very much. For you that are going to watch this video again, just be that change that you want to see. Be positive, be kind. Thank you, everyone. I will end this live stream now. Thank you. Thank you.